Hello again, everyone. My name is Marty Guthmiller, and I am the CEO at Orange City Area Health System, bringing you today the 51st edition of our COVID-19 Community Health Briefing. As it is a Monday, I do have a local scoreboard for you, and I'm going to give you hopefully some statistics that make sense. But first of all, our testing has increased a lot, and I'll get into that in just a second. But in terms of the local scoreboard, we've had 174 positives now of the 2,188 tested, and we have 29 tests currently pending. 7.95% positive rate. When we talked the last time, that rate was 8.1%, 8.15%. So dropped a little bit, but again, I don't think that's a significant variance at all. What is interesting, I mentioned we've done a number of increased tests. That number has increased. We've done 508 tests over the last week. That's a big number. And we've had 37 positives over the last week. So over the last week, we've actually had a 7.28% positive. So the take home is we're doing a lot more testing, a significant amount more. We have plenty of tests and supplies now. We are testing. I'm not at a point where I can make any assertions on that, but we are, the last week was 7.28%, and year to date, we're at 7.95%. Moving to Sioux County, again, the number of tests there increased as well. We have had 895 positives, 34 more since Friday, 5,563 tested. That's a 16.1% rate, which is going up. The times before when we've talked, the rate was 15.9, time before that 15.1, and the time before that 14.3. So 16.1 is a pretty high rate. Excuse me. What I thought I would do, because of the 16% rate, is look into that a little deeper. And on the coronavirus.iowa.gov website, you can get a bunch of stuff, but it converts the percent positives and the number of positives to a positive per 100,000 population. And that stratifies that across all counties in the state. And so I wanted to look at that. And in Sioux County, that's at a rate that if you took our positive rate and took it over a population of 100,000 people, there would be 2,564 positives. Okay, 2564, remember that number. We can then take that number and compare ourselves without a volume dynamic or variable to other counties in the state. Polk County, for example, many more people, but when you take their rate over 100,000 population is 2733. Ours is 2564, theirs 2733, so fairly consistent. Woodbury County, as an example, is 4,132. Johnson County in Iowa, which we'll talk about a little bit later, that's Iowa City, 2,537. So again, very consistent with us. BV County, 9,188 per 100,000, so significantly higher. Plymouth County, 2,941 per 100,000. O'Brien County, 1,423. So O'Brien County is about 1,000 less per 100,000 than Sioux County. I also looked, there are 28 counties in the state that have less than 1,000 per 100,000 positive rates. So it's not that 2564 for Sioux County is a great number, because there are 28 counties that are 1,000 or less. But it's not the worst number either. And it's kind of on par with some of the other markets that we've been looking at. Just more data for you to consider. Region 3, 20 counties in Northwest Iowa. We have 30 patients hospitalized. That number previous times were 28, 29, and 38. So not a great deal of variance there. It's the highest number that we've had in 3 reports, but again, we're comparing 30 to 28 and 29, so really not much difference there. We have 4 patients in Region 3 in the ICU, and we've only admitted 1 patient in those 20 counties in the last 24 hours. Moving to Iowa, 63,213 positives of the 621,708 tested. That's a 10.2% rate. Compared that to 10.0 the last time we talked, 9.5 the time before, and 9.4 before that. Again, that's not trending in the right direction and consistent with what we've been hearing. I was unable to get to the hospitalization page. I'll give you an update on that later in the week. For some reason, my computer wouldn't access that today. And no, that's not code for not wanting to talk about it. I quite frankly haven't been able to see it. So we'll get you that information probably on the next briefing that we have. We are not experiencing a great deal of hospitalizations here. In fact, none that I'm aware of in our local facility. And I assume that that's the same in Sioux County, but again, I just don't have that information right now. Deaths, we have 21 additional deaths since Friday, 1,112. Sioux County remains at 3. Another statistic, and the final statistic that we have been reviewing, is the percent positive over a 14-day average. Not good news in terms of Sioux County at 21.4%. We're the 3rd highest county in the state in this statistic. Plymouth County remains at number 1. At 23.5, and Johnson County that I mentioned earlier was at 22.6. There are 34 counties in the state of Iowa that have a 10% or higher 14-day average positive rate, and that was 35 when we talked about that on Friday. Again, we are not seeing high acuity levels here in our own health system. I can't speak for other health systems in the county or in the area, but it does appear that while the testing numbers are going higher, we are not experiencing the acuity or the sickness or the illness being at a severe level. So that is good news. I would like to close today by referring to Dr. Donlan's acronym that we've been talking about a little bit over time here. And that is the OCAHS acronym, that instead of standing for Orange City Area Health System, it stands for observation. We talk about, Dr. Donlan talks about choosing to observe matters, choosing matters in terms of your perspective, and that we tend to see what it is that we look for. And so we talked about that already. C stands for connectedness, that we must intentionally choose to connect with things in our life that matter. That isolation is bad for the human soul, literally, and connectedness. We skipped over A, and we went to health, where we talked about keeping your engine tuned. We talked about that last time. And we talked about, we will talk in the future about S for showing, which is basically walking the talk. And I'll talk more about that later. So the A stands for adaptability. And just a reminder, when Dr. Donlan talked about A of adaptability, is that everybody needs a plan going into something, but we need to be flexible. We don't know the twists and turns that this COVID thing has, and that a hard plan and rigid in our actions is not a good thing. That we need to embrace that the new normal may not be comfortable for us, but we also have to be open to the fact that the new normal may be better. And while he didn't say this, the A stands for adaptability, but the A also could stand for acceptance and awareness. And those are 2 words that he also used in this area, just to say that we need to accept the new normal, that it may not be the same, and almost certainly won't be the same as the old normal. But that it might even be better. You know, we don't know. We have to have flexible plans, and we need to be adaptable into the future. So that's it for today. I will be with you later on in the week. If you have of interest, it'll be out there for you to look at. We'd like to thank you for joining us today. To remember to control what you can control, to mask up when you're going to be around anybody, and good hygiene is really important. So stay vigilant, stay strong, and above all else, stay healthy. Thank you for joining us.